A grim milestone: first human bird flu death in the U.S. The United States recently confirmed its first human death from bird flu, marking a significant and somber moment in the ongoing battle against infectious diseases. This tragic event is a stark reminder of the potential danger posed by the H5N1 virus, a pathogen that has been closely monitored by health experts for years. While the current risk to the general public remains low, this death underscores the importance of vigilance and preparedness. Public health officials are urging everyone to stay informed and take necessary precautions. The virus, primarily found in birds, has now claimed a human life on U.S. soil, raising concerns about its potential to spread further. This news has understandably heightened concerns about a potential wider outbreak, prompting discussions on how to best protect vulnerable populations. The deceased individual, residing in Louisiana, was over 65 years old and had underlying health conditions, which made them more susceptible to severe illness. They contracted the virus through direct contact with infected animals, highlighting the risks associated with close interactions with birds. This case highlights the vulnerability of certain populations to the virus, particularly the elderly and those with pre-existing health issues. It also emphasizes the importance of limiting exposure to potentially infected animals and maintaining strict biosecurity measures on farms and in households. The situation demands close monitoring and proactive measures to prevent further spread. Health authorities are on high alert and are working tirelessly to contain the virus. This first human fatality from bird flu in the U.S. is a significant development, one that has captured the attention of both the public and the scientific community. It serves as a wake-up call for health authorities and the public alike, reminding us of the ever-present threat of zoonotic diseases. We must remain vigilant and prepared to address the evolving challenges posed by this virus, ensuring that we are ready to respond swiftly and effectively to any future cases. The current situation: cases on the rise, but still low risk. As of January 8, 2025, the U.S. has reported 66 confirmed human cases of bird flu across 10 states. This is a notable increase compared to previous years, indicating a shift in the virus's behavior and spread. This marks a significant increase from the previous 2 years, where only 2 cases were reported. The sudden rise in numbers has caught the attention of health officials and the general public alike. However, it is important to note that the current risk to the general public remains low. Most people can continue their daily activities without significant concern. This is because there is no evidence of sustained human-to-human transmission. The virus has not shown the ability to spread easily between people, which is a crucial factor in keeping the risk low. The majority of human infections are linked to close contact with infected birds, particularly poultry. This means that those who work directly with birds are at a higher risk. The virus is highly contagious among birds and can spread rapidly in poultry farms and live bird markets. This rapid spread among birds is a major concern for the agriculture industry. Health officials are working diligently to contain outbreaks in these settings and prevent spillover into human populations. Measures include culling infected birds and disinfecting affected areas. While the risk to the general public is currently low, it is crucial to remain vigilant. Public health advisories recommend basic hygiene practices and avoiding contact with wild birds. The situation is constantly evolving and the virus has the potential to mutate. This potential for change means that health officials must stay ahead of the virus. We must continue to monitor the situation closely and be prepared to adapt our response as needed. Staying informed and following public health guidelines will be key in managing this ongoing issue. A looming threat: the potential for human-to-human transmission. One of the most concerning aspects of the bird flu virus is its potential to mutate. If the virus acquires the ability to spread efficiently between humans, it could trigger a global pandemic. This is a scenario that health experts are closely monitoring and preparing for. Currently, human-to-human transmission of bird flu is extremely rare and limited. However, the virus's genetic makeup is constantly changing, and there is always a risk that a mutation could enhance its ability to spread between people. The emergence of a highly transmissible strain of bird flu would have significant implications for global health. It would likely lead to widespread illness, hospitalizations, and potentially deaths. Therefore, it is crucial to invest in research, surveillance, and pandemic preparedness measures to mitigate this risk. Section 4. A dangerous cocktail co-infection with seasonal influenza. Another concern is the possibility of co-infection with seasonal influenza. This means that a person could be infected with both the bird flu virus and the seasonal flu virus at the same time. If an individual were to become infected with both the bird flu virus and the seasonal flu virus, it could create a dangerous situation. The symptoms could be more severe, and the illness could last longer. This is because the two viruses could potentially exchange genetic material, leading to the emergence of a novel and potentially more dangerous strain. This genetic exchange can happen when both viruses infect the same cell. This process, known as reassortment, has been observed in influenza viruses before, and can result in unpredictable changes in the virus's behavior. These changes can make the virus more contagious or more resistant to existing treatments. A new strain resulting from reassortment could have different transmission patterns, virulence, or drug resistance, posing significant challenges for public health. This could lead to outbreaks that are harder to control and treat. While the risk of co-infection and reassortment is a concern, it is important to remember that it is not a certainty. Preventative measures like vaccination and good hygiene can reduce the risk. However, it is a risk that we need to be aware of and prepared for. Being informed and taking proactive steps can help mitigate the potential impact of such co-infections. Beyond human health impact on animals, food, and the economy. The impact of bird flu extends far beyond human health. The virus can devastate poultry populations, leading to significant economic losses for farmers and potentially impacting food security. Outbreaks in poultry farms often require the culling of millions of birds to prevent further spread, resulting in substantial financial burdens. Furthermore, the virus's presence in wild bird populations can disrupt ecosystems and impact biodiversity. Wild birds can carry the virus over long distances, potentially introducing it to new areas and posing risks to both domestic poultry and human populations. The economic consequences of bird flu outbreaks can be substantial. In addition to the direct losses in the poultry industry, outbreaks can disrupt trade, tourism, and consumer confidence, impacting national and global economies. A race against time: government and public health response. Governments and public health organizations worldwide are actively responding to the threat of bird flu. Efforts are focused on surveillance, early detection, containment of outbreaks, and the development of effective vaccines and treatments. Surveillance systems are in place to monitor the spread of the virus in bird populations and to detect any spillover into human populations. Early detection is crucial for rapid response and containment efforts to prevent wider outbreaks. Vaccine development is a top priority, with several candidate vaccines currently undergoing clinical trials. However, developing effective vaccines against rapidly mutating viruses like bird flu is challenging and requires ongoing research and development efforts. The path forward: vigilance, preparedness, and biosecurity. The threat of bird flu is a reminder of the importance of vigilance, preparedness, and biosecurity measures. We must remain vigilant in monitoring the virus's evolution, prepared to respond quickly and effectively to outbreaks, and committed to implementing strong biosecurity measures to prevent the spread of the virus. Public awareness and education are also crucial for prevention. People need to be aware of the risks associated with bird flu, how to protect themselves, and what to do if they suspect they may have been exposed to the virus. International collaboration is essential for effective surveillance, information sharing, and coordinated responses to outbreaks. By working together, we can strengthen our collective defenses against this global health threat. Stay informed and prepared. Subscribe to our channel for the latest updates on bird flu and other health news.